Good morning, everyone. So, myself, Dr. Praneeth from Hyderabad, the ENT consultant and faculty. So, let us start quickly. Let us go into the topic larynx. Okay. So, larynx is famously larynx is called as a voice box because it has got vocal cords which produces voice. Basically, this larynx is a fibrocartilaginous structure, right? What is fibrocartilaginous? Means it has got various cartilages. The basic framework, if you see, of the larynx, various cartilages are interconnected by your fibrous membranes and ligaments. The various membranes and ligaments you see in the larynx are fibrous component, and all the cartilages like your thyroid, cricoid, arytenoid, all these are interconnected with the help of these membranes as well as muscles. So this structure is called as fibrocartilaginous structure. If you come and see what are the different cartilages present in the larynx, they are broadly classified as 3 unpaired and 3 paired, right? What are the 3 unpaired? If you take, the most important one is the thyroid, and next you have the cricoid, which forms the complete ring lying below the thyroid, and the other one, the leaf shaped epiglottis, which comes above into the supraglottis. And now the 3 paired, the most important of it is arytenoid as well as corniculate and cuneiform. Right. So now let us see how these cartilages are arranged. If you take your thyroid like this, the thyroid cartilage, it has got 2 alae on either side. It has got 2 superior cornuae as well as inferior cornuae. This midpoint where it meets, the 2 alae meets anteriorly and superiorly, is protrudes outside in case of males, like this prominence which you feel prominently on your larynx. It is called as Adam's apple. And below the thyroid, if you see, there will be a cricoid. The thin cricoid will be there. Here a membranous attachment will be there, that is cricothyroid membrane, and from the back of the thyroid arises your epiglottis, like this. From the back of the thyroid, okay, this will be the epiglottis, this will be thyroid, and this will be the cricoid. This is your anterior view. Okay, if you take the median sagittal view, you will be having thyroid like this, which your cricoid will be running like this, and you have your arytenoids posteriorly lying over the cricoid superior surface. From here, the vocal cord will be coming and attaching to the thyroid. From the back side of the thyroid, your epiglottis will arise like this, right? Over the arytenoid lies your corniculate and cuneiform complex, like this, right? Here you will be having your cricothyroid membrane like this. So this is median sagittal view. So let us see the structure. See, this is the thyroid cartilage. If you take this entire thing is the thyroid cartilage. These are the 2 superior cornuae over here, and this is the inferior cornuae, the 2 alae of the thyroid. This is the one alae and this is the other alae. Where they meet in the midline, this is Adam's apple. Below you will be having your cricoid like this, right? And you have the hyoid bone over here, and you have the thyrohyoid membrane. Okay, this is the thyrohyoid membrane, and you have the cricothyroid membrane between thyroid and the cricoid. Okay, now if you come to the mid sagittal view, see, this is the thyroid cartilage, and from here arises your epiglottis, right? This is the thyrohyoid membrane between thyroid and hyoid, right? Thyrohyoid membrane, if you see from median sagittal view. And see, this is the cricoid. As you go posteriorly, it broadens. Anteriorly it will be like an arch, but posteriorly it will be like a lamina. On this superior surface, you have got your arytenoid sitting over here posteriorly. Here you will be having corniculate, and this is the cuneiform. This is your epiglottis, thyroid, cricoid, arytenoid. This is the vocal cord, right? You see, this is the posterior view. This is the posterior view. See how the cricoid has broadened, like this is called as lamina, right? On which on either side your arytenoids will be sitting, and your vocal cords will go anteriorly and attach. See, to the posterior surface of the midline of the thyroid, there arises your epiglottis with the help of thyroepiglottic ligaments. And see, this is the leaf shaped epiglottis, right? And you have a thyrohyoid membrane between thyroid and hyoid, right? And coming to, this is the superior cornua, this is the inferior cornua, and also you can see the inferior cornua getting attached to the cricoid, forming a cricothyroid joint over here, right? And also the arytenoid and cricoid will be forming a cricoarytenoid joint here. So this is a basic view of the laryngeal cartilages. Now let us see, first let us come to the thyroid cartilage. Thyroid cartilage is the largest cartilage of the larynx, and it has got two alae on either side. So if you take, there will be two alae on either side, and this will be fused in the midline. Anterosuperiorly, you will be having a prominence that is called as Adam's apple. This, if you see from above, they fuse at an angle of 90 degree in males. That's why it is more prominent. Okay, and if you see in females, they fuse at an angle of 120 degree females, so they will be a bit less prominent. Okay, so if you take, this is the Adam's apple. Okay, this is the Adam's apple, and so this is most prominent in males. You can feel over here, and because of males. In females it is not that prominent. Also you have got two superior cornua and two inferior cornua. Okay, two superior cornua and two inferior cornua, right? So let us see the thyroid. See, if you see, these are the two alae of the thyroid and fused in midline. This is the Adam's apple, and you can see the superior cornua here on either side and the inferior cornua over here on either side. This inferior cornua will attach to the thyroid to form the cricothyroid joint. Okay, if you see posteriorly, it is not forming a complete circle, right? So from lateral, if you see the attachments of the thyroid cartilage, here you can see the epiglottis attachment, vocal cord attachment. So coming to the attachments, vocal cord and epiglottis will get attached to the posterior surface. And coming to the, this is the hyoid bone, right? So this is your hyoid bone. To this hyoid bone and the thyroid cartilage, there is a membrane that is called as thyrohyoid membrane. Okay, thyrohyoid membrane. Okay, so this is the thyrohyoid membrane. Okay, and there are, you can see there are two openings in the thyrohyoid membrane. Okay, the two openings in the thyrohyoid membrane. Through this opening runs your internal laryngeal nerve, vein, as well as artery. They run from outside to inside. All the internal laryngeal artery, vein and the nerve, from outside they run into inside of the larynx through these openings on either side. And you can see also in between your epiglottis, thyroid cartilage, thyrohyoid membrane and hyoid bone, hyoepiglottic ligament over here. Okay, there is a triangle formed that is called as pre-epiglottic space. So we will come to it later on. And now coming to the cricoid cartilage. only cartilage forming a complete ring. Okay, so it forms a complete ring. So anteriorly, if you see, it will be in the form of a thin bar like, that is called as arch. And if you see from lateral, this is anterior and this is posterior. See, the width of this arch increases as you go from anterior to posterior. Okay, this is lateral view. If you see from posterior view, this will be a broadened plate like. This is called as lamina if you see from posterior view. Okay, so this is about cricoid cartilage. The cricoid attachments, if you see the cricoid attachments, there is a cricothyroid joint is found in between cricoid and thyroid cartilages, and cricoarytenoid joint is formed between cricoid and arytenoid cartilages. And see the cricoid, this is the cricoid arch anteriorly. Okay, this is your arch. If you see laterally, it gradually increases in its size, right, laterally. And if you see posteriorly, see how broad it looks like compared to anterior arch. The posterior, this is lamina. On this surface, your arytenoids will sit here like this. Okay, so this is about your cricoid. Also know about the cricothyroid joint here and cricoarytenoid joint over here. Okay, so we'll see it in the next slide. And now, see, this is the cricothyroid joint. See, the inferior cornua of the thyroid is attaching on the cricoid posterolateral surface. Here, the thyroid will swing over like this. Okay, it will move like this. A 15 degree of movement is followed here. Okay, so this kind of movement, so this kind of anterior swinging movement is possible at the cricothyroid joint. Okay, so now coming to the next cartilage, that is your epiglottis. It is a leaf-shaped cartilage attached to thyroid by thyroepiglottic ligament. It is also attached to hyoid above. Thyroid, it is attached below hyoid above with the help of hyoepiglottic ligament, right? So it is a, see, this is your epiglottis. With the help of thyroepiglottic ligament, it arises. It is a leaf-shaped cartilage, right? So if you see laterally, this is the thyroepiglottic ligament and this is your, and also to this hyoid bone, it is attached with the help of a ligament. This is nothing but your hyoepiglottic ligament. And if you see the thyroid membrane and the thyroid cartilage below and posteriorly the epiglottis, you are getting a triangular space over here. This space is called as pre-epiglottic or Boyer space. Okay, so this space is normally filled with fat, but in case of carcinoma like supraglottic carcinomas as well as base of tongue carcinomas will spread to this space. Okay, the management protocol varies depending on their extension into this space or not, right? So this is about your epiglottis. And now coming to your the most important arytenoid cartilages. Okay, so the arytenoid cartilages are two paired cartilages that lie on the posterior cricoid lamina superior surface. they form cricoarytenoid joint on either side. At this joint, two kinds of movements will happen: gliding and rotating. Okay, so these two, if you see the arytenoid cartilages, see on the posteriorly, this is the cricoid lamina, superior surface. Here your arytenoids are sitting, the pyramid shaped arytenoids are sitting on either side. If you see from the mid sagittal view, these arytenoids have got anteriorly, they have got a vocal process, and posterolaterally they have got a muscular process. So they have got a vocal process anteriorly to which your vocal cord is attached, right? And posterolaterally you have got a muscular process which is present posterolaterally, to which various intrinsic muscles are attached, right? So this is about arytenoid. It has got an apex, vocal process, muscular process, right? And the cricoarytenoid joint, if you see, okay, so these are the cricoarytenoid joints. If you can see here, the types of movements possible is they can rotate as well as they can glide. See, there is a gliding kind of movement possible here, as well as there is a rotatory kind of movement possible here. The arytenoids can rotate inward, outward on this cricoid surface. Also, they can move forward, backward on this cricoid lamina surface. Okay. So, at this cricoarytenoid joint, both gliding, this is gliding, as well as this rotating, this is rotating. Okay. So, these two kinds of movements are possible. Why this is important is later on to understand the vocal cord adduction and abduction, this is important. Right. Now coming to the next, that is your corniculate. They lie on your arytenoid. They lie over the arytenoid. Okay. If you take this is the arytenoid, and this small piece, if you see, these are corniculate cartilages. They are also known as cartilages of Santorini. Okay. Where else you get this word Santorini? Fissures of Santorini. What is fissures of Santorini? If you take your ear pinna and external auditory canal, tympanic membrane, your external auditory canal divided into outer 1/3 cartilaginous and inner 2/3 bony part. Small foramina in the inferior surface here are called as fissures of Santorini. Here your parotid gland will be there, isn't it? Infections through these fissures of Santorini will spread to and fro from parotid and external auditory canal, cartilaginous part, right? So these are fissures of Santorini. Okay, cartilages of Santorini means corniculate cartilages in the larynx. And coming to the next cartilage, that is cuneiform. These cuneiform cartilages are nothing but one small piece of cartilage piece that lie over this corniculate cartilage. They lie over corniculate cartilages. They are also known as cartilages of Risberg. Where else you get this word Risberg? There is word called nerve of Risberg. What is this nerve of Risberg? Sensory branch of facial nerve, facial seventh cranial nerve, also called as nervus intermedius, right? It supplies posterior meatal wall. Okay, so what happens if this gets affected? Hypoesthesia, compression of this nerve in acoustic neuroma. What happens? There is a sign, the hypoesthesia of posterior meatal wall. The acoustic neuroma tumor compresses this nerve and causes hypoesthesia of the posterior meatal wall. That sign is called as Hitzelberger sign. Okay, Hitzelberger sign. So this is the sign that indicates first sign that indicates facial nerve involvement in case of your acoustic neuroma. Okay. Now coming to the next topic, that is your quadrangular membrane. Also called as PRE-EPIGLOTTIC fold. Why it is called as PRE-EPIGLOTTIC fold? It covers anteriorly epiglottis and arytenoids posteriorly, as well as it lies on all four sides. That is why it is quadrangular membrane. If you take the lateral view of the cartilage, thyroid, and you have your epiglottis, you have your vocal cord attached to arytenoid, your arytenoid sits over your cricoid, right? You have the corniculate cuneiform over here, right? So this quadrangular membrane, anteriorly it will be covering the epiglottis and posteriorly it will be covering the arytenoids. Okay, so these are the arytenoids, epiglottis. That's why it is PRE-EPIGLOTTIC fold. Okay, so it covers on all four sides. Okay, and enclosing a space in between. Through this is nothing but your laryngeal inlet. Through this only you will enter your larynx, inside of your larynx, isn't it? Right. So it is connected above to your right. So this is your right oral cavity, oropharynx, oral cavity, like this. Okay. So this is the laryngeal inlet. Okay. Posterior to this you will be having your esophagus. Right. So now this quadrangular membrane, if you see already we know from here your epiglottis has arisen like this, isn't it? And here already you have got over the cricoid lamina, you have got arytenoids over here, right? This entire thing is the arytenoid complex, right? Okay. See this epiglottis, this is covering the epiglottis anteriorly, and posteriorly it is covering the arytenoids also. This bulge you can see is the arytenoid bulge on either side. Okay, see this is the arytenoid bulge on either side, you can see. Okay, and this is the epiglottis. So this is covering all the four sides, that is quadrangular membrane, and anteriorly epiglottis, posteriorly arytenoid. That's why it is PRE-EPIGLOTTIC fold. And through this you enter your larynx inlet. This is the laryngeal inlet. Okay. The laryngeal inlet is formed by the superior surface of PRE-EPIGLOTTIC fold. Okay, right. So now coming to the this false vocal cord. If you take this lower border of the PRE-EPIGLOTTIC fold, even in endoscopic view also you can see the mucosal fold, and see these are the arytenoid prominence. Over the arytenoid you have this mucosal covering, right? See this entire thing is the PRE-EPIGLOTTIC fold. Okay, on either side. This lower border of this PRE-EPIGLOTTIC fold, see the lower border of this PRE-EPIGLOTTIc fold, this lower border is thickened. Okay, the lower border is thickened to form false vocal cord. It is also called as vestibular fold. The voice produced by this condition is called as dysphonia plica ventricularis. Okay, if you take, this is the true vocal cord margin. Okay, this is the true vocal cord margin. So these two vocal cords will come together in midline to produce voice normally. But instead of this true vocal cord, if this false vocal cord is coming and vibrating and medializing each other, and they are producing the voice, that condition is called as dysphonia plica ventricularis, abnormal speech production. The treatment for this condition will be to give speech therapy. Okay, and now see, there is a space in between the, so now in between this, if you take your this one, thyroid cartilage, you have your epiglottis like this, you have your vocal cord, arytenoid, you have your cricoid like this, right? Okay, corniculate cuneiform, you have your fold like this, right? Aryepiglottic fold like this. You have this lower border is thickened to form the false vocal cord. This is the true vocal cord. The space between this false and true vocal cord is called ventricle of larynx. Okay, this is the ventricle of larynx. Through this ventricle you can enter laterally inside. Okay, so through this ventricle you can enter lateral to this aryepiglottic fold inside. That space is called as saccule of larynx, which is rich in mucus glands and the secretions. The function of this mucus is to wet the vocal cords. Due to its richness in the mucus, this saccule is also called as oil can of larynx. Okay, and due to this wetting of the vocal cord, there will be reduced friction between the two vocal cords during phonation, so that the phonating part, the touching both vocal cords parts, won't get damaged, injured easily. Okay, there will be friction will be reduced, so less heat generation, so less trauma. Okay, and if there is a condition in case of glass blowers and trumpet players, that is called as laryngocele, most common in glass blowers and trumpet players. Okay. So this condition, nothing but it is air filled cystic dilatation of the saccule. So what happens when there is a dilatation of the saccule? Just if these are the aryepiglottic folds, here the saccule will be there. So once this bulges, what happens? The aryepiglottic fold will get medialized. See, this is the aryepiglottic fold, isn't it? So this is the arytenoid prominence on either side. Okay, the arytenoid prominence on either side, interarytenoid region. Okay, and you can see the aryepiglottic fold like this, right? See, on one side, on this side, you can see there is a bulge coming inside, isn't it? So there is a pushing at the back. This is the false vocal cord, this is the true vocal cord. In between this, if you enter, you can enter upside. The lateral to this aryepiglottic fold is the saccule of the larynx. There air-filled cystic dilatation will occur, and that will be causing the bulging or pushing of this aryepiglottic fold medially into the lumen of the larynx, supraglottis. So that may cause sometimes airway obstruction. So there are three types of laryngocele. Internal. What you are seeing is, this is the internal laryngocele that can be seen on endoscopy only. Internal. To visualize this, you have to do endoscopy, right, or laryngoscopy. And there is other type, that is external. It presents an external neck swelling. Okay, it pierces the thyroid membrane, and comes outside to lie outside. Okay, this is the external component. Okay, external part. Okay, and mixed is that it will be having both internal as well as external. Okay, so if you compress this neck swelling, what happens? There will be some hissing sound. Okay, so due to this hissing sound is due to air leak into, because it is a air filled cystic dilatation, air leak into larynx. What is this? This is called as Bryce sign. Okay, so Bryce sign is seen in laryngocele. Okay. Now coming to what is the other signs you see, like this Boise sign, that is Zenker's diverticulum. Instead of hissing sound, you will hear a gurgling sound due to the regurgitation of contents back into the esophagus. That is your Boise sign seen in Zenker's diverticulum. Okay, so now, so that's it. This is about your larynx anatomy, a brief view of larynx anatomy.